Patient selection for dental implants. Selecting the right patient for dental implant treatment is a very crucial step to save time, energy, money, peace of mind for both you and your patient. This podcast focuses on the right patient for the right implant. Let's start by saying this. Not every patient with a missing tooth needs a dental implant. In fact, one of the most important skills in implant dentistry isn't how to place an implant, it's knowing when not to. Why patient selection matters? Because implants are predictable, but only in the right hands and in the right patient. If you ignore systemic factors, bone conditions, or patient compliance, you're not restoring a smile. You're planting a complication. You might get osseointegration, but long-term success, that depends on patient selection. There are times beautifully placed implants fail, not because of surgical error, but because we didn't take a step back and ask, is this patient ready? Implants don't fail in the operatory. They fail months or years later when the biology catches up to the dentist's decisions. Who is the right patient? A good implant candidate is more than just someone with a missing tooth. Here's what I look at. Systemic health. Are they medically stable? Diabetics can get implants, but only if controlled. Smokers, maybe. Heavy smokers with poor hygiene, not worth the risk. Oral hygiene. If a patient can't maintain a toothbrush, how will they maintain a titanium post? Bone availability, quantity and quality matter. No bone? Then we need grafts, sinus lifts, or alternative options. Expectations. Do they understand what implants are, and more importantly, what they are not? Unrealistic expectations can turn a great case into a legal headache. Compliance. Will they return for follow-ups? Will they wear their night guard if needed? Will they avoid smoking after grafting? Implants are a partnership. You do 50% in the clinic, the patient must do the other 50% at home. How wrong patient selection affects treatment. Now let's talk about what happens when we choose wrong. Peri-implantitis. Poor hygiene or smoking leads to inflammation, bone loss, and eventual failure. Early failure. In uncontrolled diabetics or irradiated patients, integration may never occur. Overloading. Missing multiple teeth but restoring only one. That implant becomes a stress-bearing hero until it fractures or fails. Psychological stress. Patients who expect magic will be disappointed with reality, and even a successful case may feel like a failure to them. Remember, implants don't fail just because of bone. They fail due to biology, behavior, and biomechanics. So here's the takeaway. Placing an implant is science, but selecting the patient is wisdom. Learn to say no. Learn to delay treatment. Learn to educate your patients. Because a well-selected patient with modest bone and average healing is still better than a medically compromised one with great bone and high demands. If you choose your patients right, your implants will take care of themselves.